Every day millions trust that the water flowing from their taps is safe. But what if that trust is misplaced? Across the country, families are discovering invisible threats lurking in their drinking water, threats that can change lives forever. Lawrence and Penny Higgins learned their well was contaminated with PFAS, a group of toxic chemicals linked to serious health risks. Their world was turned upside down overnight. For decades, they unknowingly drank and used this contaminated water, putting their health and their loved ones at risk. The impact reached beyond their family, affecting pets and farm animals as well. Penny's search for answers was met with silence. Even healthcare professionals struggled to provide guidance. PFAS, or perfluoroalkyl and polyfluoroalkyl substances, are found in countless everyday products. Known as forever chemicals, they persist in our environment and bodies, building up over time. Despite mounting evidence of harm, many clinicians remain unaware of the dangers PFAS pose to public health. These chemicals have been linked to cancer, immune system problems, and developmental issues in children. Nearly half of U.S. tap water may be contaminated with PFAS, making awareness and action more urgent than ever. In Maine, officials responded by testing water and soil, uncovering widespread contamination. The results were alarming, revealing just how far-reaching the problem had become. Yet when hotspots are found, healthcare providers often lack the resources and training to help affected families. Dr. Rachel Criswell, a family physician, has made it her mission to educate colleagues about PFAS dangers. Since her residency in central Maine, she's led efforts to raise awareness and share vital information. She offers presentations and resources to help clinicians respond to PFAS exposure in their communities. And she continually updates her practice as new scientific guidelines emerge. It's exhausting work, she admits, but it's essential for protecting our patients and our communities. For Adam Nordell and his family, learning about their exposure was devastating, but it also gave them the knowledge to act. Decades-old sludge spread on their farm had introduced PFAS into their lives. Blood tests revealed dangerously high levels, forcing difficult decisions about their future. Ultimately, they left the farm they loved to protect their health. Knowledge is power, Adam reflects, and understanding our exposure gave us a sense of control. Their experience shows how critical it is for families to have access to information and support. Accessible testing and informed healthcare guidance can make all the difference. But for many, the high cost of blood tests, often not covered by insurance, remains a major barrier. Families facing PFAS threats are left to navigate these challenges on their own. In response, Maine lawmakers have proposed requiring insurance coverage for PFAS blood testing as preventive care. While the bill awaits further action, such measures could make vital screening available to all. Dr. Criswell urges the medical community to treat elevated PFAS levels as a serious risk, just like smoking. Integrating PFAS education into medical training could transform how we protect patients from this hidden danger. Simple steps, like including lab codes and insurance details in clinical handouts, can help practitioners support those at risk. The question remains, how can we ensure every community has access to safe, clean water? The stories of the Higgins and Nordell families remind us that awareness is only the first step. Systemic change is needed to protect everyone. We all have a role to play. Advocate for stronger protections, demand transparency, and support those affected. Together, we can secure a healthier future for all.